In this presentation, we will go over knobology. Many of you have likely seen an ultrasound machine in obstetrics, maybe on your unit, maybe in a clinic, maybe on yourself or your partner. It can be quite overwhelming to see all of the knobs, all of the buttons, all of the things, and quite intimidating. Maybe you don't want to mess things up, you don't know what they're used for. I've been there. And so I am going to go over the basics of knobology to help you understand what you can do to enhance and get a better image, and also to understand when you have the sonographer that you're working with, adjusting things possibly for you or with you to know what is happening and what is making things clearer and better for you to diagnose and manage the patient situation. The different knobology is often referred to as the transducer, the application or preset, depth, gain, near field, and far gain, which is often seen on a sonosite, time gain compensation, which is a little bit more in depth, but I'm going to go over it. You often won't use that, and then focus. So what you need to know, first, when you come into a room, you need to make sure, is the transducer correct? Are you doing a vaginal ultrasound? Are you doing a transabdominal ultrasound? Is the right one selected? You will know right away if it is not, because it won't show up. So I've many times put a transducer on a patient and it is not showing anything, and then I realize, oops, it's the transvaginal one is selected. And so you can change it. Usually that's a pretty easy thing, and this is showing an image of where that is located. The next thing that is really important is to make sure that the application or preset is correct. So is it selected? Sometimes sono machines may have cardiac on there, or lungs, or abdomen. And so if you're looking at a fetus, when you're trying to measure, or when you're trying to, even just the way that the sono will self-correct and adjust, which is amazing, because as we become more advanced and the sono machines have better technology and more innovation, it helps you, and so it will adjust and it'll have the right gain and the right depth for what you're supposed to be looking at. So you will make sure that the right application, or another word for it is called a preset, is correct. It's important that you know these words, because this is the way that we talk about sonos. And so just like when you're in a C-section or you're in a surgery, and it's important that you know the right instrument so that you can communicate and you can take care of the patient the best. It's also very important that you use the right terminology when we're talking about sonography. So depth is the depth the machine will scan. So that's pretty self-explanatory. When we increase the depth, the numbers increase on the right side of the screen. So you can see on this image, and when we have our hands on the sono machine in clinical immersion, you can practice this and we can talk about it. But this helps us, it's where the machine is able to, the sound waves are able to focus, and the depth that it will scan. In this, you can see that the depth is increasing, and so it starts off where it's just showing a small portion of the scan, and then as it's increasing, you can see that it is showing more of the area. And then here is a video of the depth decreasing. So it starts out showing a larger portion of whatever it is scanning, and then they are decreasing the depth, and that just shows a smaller area. So this might be useful if you are trying to look at a gestational sac, or trying to look at something deeper. So maybe you're doing a gynecologic exam, and of course, if it's not deep enough, you're not going to be able to see what you need to see. The next thing we'll talk about is gain. Again, this is focusing on using the right terminology. So gain is how bright or how hyperechoic. So hyperechoic means there's lots of sound waves. And so it's brighter, or how dark, how hypoechoic you want your image to appear. So it's important that the image is showing up clearly so you can identify the different structures and the different possibly fetal parts or whatever you're looking at. So you can see in these three images, you have an undergained image where it's very dark. So it's hypoechoic. Hypoechoic meaning dark. And so you really can't see the different structures. And then you can see the next one is overgained ultrasound image, and so it's really bright, and the brightness, it makes it really hard to differentiate the different structures as well. The last one is the optimal gain ultrasound image, and so this is important, especially when you're looking at specific things on the ultrasound. They may adjust the gain when they're looking at the fetal heart, if you're trying to see the amniotic fluid, things like that. The hypoechoic area would be dark. So when you're documenting, that's important to know. You can say there is a hypoechoic mass next to the placenta. So that tells us there is some sort of, usually that is fluid. It could be fluid, or sometimes like a blood clot may look a little bit hypoechoic compared to the placenta, which would be more hyperechoic. So we're going to talk about near field and far field gain. This is often on a sono site. They are just buttons. You can adjust the button. So the settings allow you to fine tune and adjust the gain at specific depths of your image. So the near field, you can see the near field on the images at the top. So that's anterior, the patient's anterior. And then far field is the posterior part of the patient. And so you can adjust the gain on this is showing the sono site. So not all ultrasounds have this. They may have a variation of this. And then you can also adjust the gain overall. Time gain compensation. This allows you to adjust the gain at almost any depth of your ultrasound image and not just the near and the far fields. Again, this is getting into more in depth. This is more of the adjustments that a sonographer may do to clearly identify different structures. And this is what you'll see on the more advanced sono machines, or the sono machines that you typically will use in your clinical practice, and not the little sono sites that they roll in possibly in like an OB triage area, or sometimes in your clinic that you use. This is what the sonographers will have often on their ultrasound machines. And then we'll talk about the focus. So the focus optimizes the image by adjusting the focus to concentrate the ultrasound waves at a specific depth of the image. So this maximizes the resolution at that depth. And so again, you can see on this image the little green arrow, and it's showing you that those sound waves are focusing at that depth. And so that way it can identify the structures better at that depth. This again is used often with looking at the fetal heart, possibly looking at the umbilical cord insertion site, or different things like that. So we talk about freeze. The freeze button freezes the frame so that you can have time to view it in more detail. This is what we use when we take a picture. So when you have you're looking at the baby and you get that perfect profile view that all the families love, and so you can freeze it. And so one, it shows you the bridge of the baby's nose, and a lot of times the the nasal bone, but the family likes to have that image. So this is often what we'll do to freeze the image to either get measurements when we get a femur length, or when you're measuring the abdomen of the baby or the head circumference, you'll freeze it and then you can do the measurements. So the clippers are what is used to measure different structures. So this you would use to measure the femur length or the head circumference or the biparietal diameter. And then we can also do an image or a video capture. Sometimes it's termed the cine. And so this can capture an image or a video clip of your ultrasound scan. Often they will do it's a very short, few second video, but this is helpful when you are wanting to document that you've gone through the entire plane of the uterus. So especially when you're wanting to confirm that you don't have twins and you want to document that you confirmed that, you can go through the whole both planes of the uterus to show that you did in fact look at the entire uterus. So we'll talk about the different modes. I know I mentioned this in another one of the PowerPoints, but there are different modes. So this is the continuous wave Doppler mode. This is what is used with the handheld Doppler. This is higher or sometimes higher end ultrasound machines for fetal echoes. So often not in a normal OB-GYN practice. So when you go to high risk, you may see where they have the capability of doing a continuous wave Doppler for a fetal echo or cardiology, looking specifically at the cardiology. The pulsed wave Doppler is what you'll see when they do umbilical artery Dopplers, the MCA Dopplers, and then the color Doppler that looks at the color, and then the M mode and real-time B mode, which is the 2D grayscale, which is what most people are familiar with. So here are the different modes. Most of them have them at the lower side. I feel like it's pretty consistent, but as you have different ultrasound machines, it may be slightly different. So you select either it could be a button or where you navigate the screen with a cursor, and you can select the different modes. So you want to make sure you're on the one that you want to be on. So a B mode or real-time mode creates a two-dimensional 2D grayscale image. So these are the cute little profile pictures like I talked about. These are often used to look at different structures, do measurements when we're doing fetal growth. When we're looking at doing a BPP, we can watch the baby's lungs moving and we can watch the baby moving. It is getting several images, and sometimes it's even real time. So that's what most sono machines are doing these days. So the M mode is defined as a motion versus time display of the B mode. So it's similar to the B mode, but it's showing it in motion versus time, and it's showing along a chosen line. So it's focusing on, in this case, the fetal heart, and it's showing motion. And so this is very hard to see, but you can see the lighter, which we call hyperechoic areas that the blue lines are going through, and that is a fetal heartbeat. So you see one movement there, you see the other movement there, and so when you put the clippers on those two locations, it can tell you the fetal heart rate. And so in this image, it is showing a fetal heart rate of 129 beats per minute. And this is the safer option for assessing the fetal heartbeat because it has a low exposure when the baby is below 12 weeks. So this is what is recommended to use. The color Doppler visualizes movement of blood in the arteries and veins. Red means there is flow towards the ultrasound probe, and blue means that there's flow away from the ultrasound probe. It's important to know that the red and the blue does not correlate with arteries and veins. It's just how the blood flow is moving towards or away the ultrasound probe. So that is not going to tell you if it's an artery or vein, so please remember that. But it does show that the blood flow is moving in different directions, which is good. And so you can see on these images, it's looking at the umbilical cord where it connects to the placenta. It's also looking at the fetal heart. And then another image is looking at the outflow tracts on the fetal heart. That's the curved image. And then the last image on the bottom where there's a hypoechoic area, that is showing the veins around the bladder. So the pulse wave Doppler mode measures the velocity of blood flow. And so we do this when we're looking at the umbilical artery Dopplers. And so we're looking at the blood flow from the baby to the placenta. And then when we're looking at the velocity in the middle cerebral artery velocity. And so that's, we're looking at the blood flow in the fetal brain, in the middle cerebral artery and the baby's brain. So when we're talking about AP-GYNs and ultrasound basics, it's important that we always find the fetal heart rate, the placenta location, and the fetal position, fluid level, and does the baby have arms, legs, body, head, and is it twins? I want to stress the importance that I always find the fetal heart rate first. And I do this because, one, I'm fortunate to have a mother that's a sonographer, and that's how I got most of my training, either by her or one of her colleagues. But she has told me stories about how she has done a whole ultrasound before and then realized at the very end of it that the baby didn't have a heartbeat. And so that can be quite concerning. And so of course, you look and you see, is there a baby? And then when you're looking for the heartbeat, you can tell a few things, where the baby's position, things like that. But it's important to look first at that. In my opinion, that's what I do first. And then you always want to know where the placenta is located. And then just, the next things are fetal position, fluid level, arms, legs, head, body, and then is it twins? So the position of the ultrasound probe is very important too. The anterior, the top of the screen is anterior, and it should always be anterior, and the bottom of the screen is posterior, and you need to make sure that your probe is positioned correctly. So we'll talk about how to do that. The left of the screen is always the patient's left. So when you're looking at the screen, you should be able to orient yourself to where this is in the actual patient. So when we talk about the ultrasound probe transducer placement, we'll talk about the transverse scan, or it's called the coronal scan, or the longitudinal scan, or or we call it sagittal. So you can see that the transverse scan is the transducer is placed on the maternal abdomen in a transverse lie, and then whenever you look at the longitudinal scan, you can see that the transducer is placed in a longitudinal position. So we'll go into that in a little bit more detail. So when we have a transduce or coronal scan, we're looking at the marker will point, so the index or the orientation marker. So when you look at the ultrasound probe, and you can kind of see it in this picture, there is a little bump on the right side of the patient's body, and also the probe is pointing that direction to the patient's body. So this makes sure that the image on the screen, the left of the screen is corresponding to the patient's left, and the right of the screen is corresponding to the right of the patient. You will look, and when you look at this, you will see the cervix to the fundus, and it will cut in cross sections, kind of like a CT scan. So you're going to think of things in a cross-section view. So you'll start at the symphysis pubis and move upwards towards the head. That when you learn sonography, they do teach you to have a very structured way of doing things rather than just like scanning all over the patient. That way you keep your reference and the locations of the location of the female anatomy correct when you're looking at when you're assessing the mother and the fetus. And so I do recommend that, especially in the beginning. A lot of times you'll see more experienced sonographers or more experienced midwives not follow a very strict pattern. But for you as you're learning, I would recommend that you start at the symphysis pubis and move up towards the patient's head. So with a transverse lie, you're going to see the uterus, the bladder, and the right and left ovary all cut down through the middle. So you can see the position of the transducer. You can see, kind of an interpretation of that magic eye like we talked about earlier. And then in the images next to it, you can see where the bladder is, the uterus, the right and left ovary. And then you can see as they move down, they're cutting through the uterus. So you'll see a cross section of the uterus. And then these are just more pictures of the transverse uterus. And so this can help you identify a didelphic uterus, different, you can look at the endometrium. Here are some more pictures of the transverse imaging. And you can see the uterus, the right and left ovaries on both of these images. The hypoechoic area above the uterus is the bladder. When you're looking at a gynecologic patient, it's really helpful to have the patient have a full bladder to help those sound waves move through and better capture the structures of the anatomy. Any patient, really, it's helpful to have a full bladder in most cases. And then here you can see this is a transverse image of the fetal skull. And so this helps to identify the different structures in the baby's brain. Often, again, as a midwife sonographer, we are not looking at the anatomy of the baby in most cases, but you can identify the cisterna magna, the thalamus. And so when a sonographer is doing a anatomy scan, they are going to be identifying these structures, measuring them, making sure that they're within normal limits for the gestational age of the baby. So let's just stop right here for a second and think about when we're doing a transverse image of the fetal head, it may be a different position of the ultrasound probe because the baby's head may be on the side or up at the top or down below or, kind of angled in a diagonal way. And so when you're doing the probe, when you're moving the probe, you're going to be focused on how the baby is lying, and then make sure that you angle that sonoprobe to capture the image that you're looking for. And so this is not going to be like the position that we saw in the picture because the baby can move all throughout the mom's abdomen. So now let's talk about the longitudinal scan, or we also call it the sagittal scan. The marker, so you might see in the image the little divot on the ultrasound probe is going to point towards the patient's head. And so the top of the screen will represent the patient's head, and the bottom of the screen will represent the patient's feet. So top to bottom. So the midline, the recommendation is to start in midline, move to the right, and then move to the left to make sure you capture the entire area. Again, like I said, more experienced sonographers and midwives may do it a little differently, but as you're practicing, I recommend that you kind of you practice this technique. So this shows the longitudinal view where you can see the sound waves are going longitudinally through the patient, and so it's looking at the bladder and the uterus in a different view. And so again, remember how I said that the top of the image is the patient's head, and the bottom of the image is the patient's feet. So you can see the bladder, of course, would be above the cervix, and so that would show you that you're in the right position, and that's the view that you're going to get with this placement of the probe. So again, there's some more pictures so you can see the position of the sonographer's or the midwife's probe, and then the image that it would show on a gynecologic patient. And then this one is very helpful when you're trying to look at the placenta location. So is the placenta low? Is it a placenta previa? Often they will look at this image in this photo where it says mixed echoes. That's where we are concerned that the placenta is abnormally implanting, so there's a placenta accreta possibly. And sometimes you can see it kind of growing into the bladder. Again, this is something that the sonographer would see, and then we'd confirm with an MRI, but this is the position that they look at, and the probe, how they're going to be holding the probe when they're looking at that. So you can actually see the fetal head in that section, in that image as well. And you can also, in the other image, you can see the endometrial thickness, you can see the bladder, and the uterus. And then here are just some more images showing this position of the probe where it's cutting through the bladder. You can see the placenta and the cervix. So this is helping to identify, is there a placenta previa? And then the lovely longitudinal picture of the baby. So this is the one that we all know and love. And again, like I said earlier, the baby may be positioned several different ways inside the mother's uterus. And so it won't look, the way that you hold the probe will not be up and down like you see in those other images. You will have to position it and capture the right image based on how the baby is facing. Okay, so this is a little test. So is this longitudinal or transverse?